All right, well, welcome back to another sports and mental health conversation. I am Will Driscoll, the executive director with the Virginia Sports Hall of Fame, and these conversations, as they have been all year, are a part of the Youth Sports Mental Health and Wellness Alliance, a formation formed in partnership with the Virginia Sports Hall of Fame, the Children's Hospital of the King's Daughters, and numerous other stakeholders throughout Southeastern Virginia. Today, we are continuing the conversation on sports and mental health as it relates to youth athletics with the director of CHKD Sports Medicine, Dr. Joel Brenner. Dr. Brenner, thank you so much for joining us today.
Thanks for having me, Will.
Well, we've talked about numerous issues, and as we've done with many of these conversations, we're going to touch on a couple issues under the overarching umbrella of sports and mental health. But you are the director of CHKD Sports Medicine, but you have also discussed at length the idea of mindfulness. When did the mental health aspect of sports start coming into sports medicine in your view?
So mental health, we've been dealing with that in sports medicine, at least in my practice, and nationally for years, for over the 20 plus years that I've been doing sports medicine. We would deal with it from a sports specialization and overuse standpoint and the effects that would have on the young athlete, but it was more informal and just as part of the treatment process. But what we've seen just nationally is with the rise of mental health issues in athletes, it's become more important that as sports medicine providers that we address it. What we know from current statistics is that greater than 40% of 12th grade female athletes report moderate to severe anxiety and depression. And recent data also shows that Division I athletes, half the males, one third of the males and half the female athletes have symptoms of anxiety and depression. So with that rise, we've nationally have come out with more position statements about the mental health of athletes. And at CHKD, that's why over the past 3 years, we've formalized a more formal mental health approach with the mindfulness coaching for young athletes too.
So now you deal a lot with the injury process, the physical side of sports and the recovery. How much of that process is mental and the emotional side of things, especially when you're talking about recovery from injury?
I mean, it's huge. It's a really big part of the process. When an athlete is injured, a couple things happen. One, they can have a loss, either permanent or temporary loss of their athletic identity, something that they've been doing for a long time. There's also a fear of re-injury as they're going through the process, especially for major injuries like an ACL tear or an Achilles tendon rupture or other things like that. And then important for the athletes as they're going through the recovery process to keep the motivation going too, to get back to their sport or another sport or just being physically active. And I think one way to do that is to keep goals in mind, take it day by day, have short-term, have long-term goals, and remember what the final outcome that they want.
How important is the role of the coaches, the parents, the adults in the room to help the athlete during that process?
Yeah, I think it's really important that everyone is helping the athlete. I think first and foremost, there needs to be support. So athletes need to support athletes, and the parents and the coaches need to support the athlete. We also need to decrease any pressure that the athlete might feel to get back to their sport sooner, or to get back to the sport at all if they no longer want to get back to that. And then we need to also keep the communication lines open between the coaches, the parents, the athletes, and everyone as a group to help facilitate the athlete.
You know, that's a great point. We've talked, one of our monthly focuses earlier this year was communication, and you really started to see how important it is, not just athlete to athlete, coach to athlete, but parent to athlete, parent to coaches. There are so many different channels of communication. So it's very encouraging to hear that that is a part of the coping process that CHKD puts forth whenever they're helping along with the recovery process. But everything in an athlete's development is connected in some way, from proper training to how they take care of themselves. But you have really, I discussed it earlier, you really talked about the idea of mindfulness at length. When you talk about mindfulness, when you hear that term, what does that mean to you, and what are you trying to convey to the athletes and their parents?
So first of all, to define mindfulness, it means paying attention on purpose to the present moment and without any judgment. So making sure that we're aware of what's going on right now, not multitasking, and understanding what we're feeling, what our thoughts are, and that can help us from so many ways. It can help us just emotionally regulate what's going on. It also helps from a mental skills training too. So one of the things that we know is that, sports, people have different percentages of what they might consider, but some people say that, success in sports is 10% physical and 90% mental. So no matter what we think that percentage is, there's a large part of success being mental. And it's not just in sports succeeding. Again, when we're dealing with especially young athletes, we want them to succeed as people for the rest of their lives. So we want to also just help them from a mental skills training, from a mindfulness standpoint. A lot of things that we talk about in the mindfulness coaching can help them throughout their academic career, throughout their professional career, when they're done with organized sports and beyond.
At what point should a youth athlete start thinking about mindfulness, or maybe start understanding it a little bit better?
I think everyone can benefit from it. You don't have to be injured. You don't have to be feeling depressed or anxious or stressed, because it can help. It can help the athletes, the coaches, the parents. I think everyone can benefit from it. There's really no side effects to learning about mindfulness. It doesn't cost anything. It doesn't take a lot of time. And it's kind of fun once you really learn more about it and get into it.
Well, one of our future discussion topics as part of our monthly focus here with the Sports Mental Health Monday post is going to be kind of self-care, how the athletes can take care of themselves. And we're in the summer right now. So right now there is a little bit of a lull for some athletes. There are some that are still playing, year-round sports. But as we look ahead to the fall sports seasons and the schools starting to come back online, what can athletes do to take care of themselves, and how important are techniques such as sleep and nutrition to their overall development and ultimately their mental health and wellness as well?
Yeah, I think there's, again, as kids are training, a lot of times they're training year round without any breaks, and they might be training 7 days a week. And one thing we need to remember, that part of any good training program is built-in recovery. So having some time off during the week to allow your mind and your body to recover. That's how our muscles get stronger. That's how we learn new movement patterns. And that's why we see the professional athletes always having an off season, having time off during the week. Unfortunately, young athletes don't always get that. So part of that recovery, also those sleep is one part of that. We know that proper sleep and adequate sleep can help both from a performance and a decreased injury standpoint. So really the sweet spot is to get about 8 to 10 or 11 hours of sleep a night, not really napping during the day. And that's really important to do that. The other part, from a nutritional standpoint, a lot of people forget about nutrition. We work hard on the skills, but then we're going for fast food and just trying to get some food in between classes, in between practice, and before we go to bed. And so I think it's important, not necessarily that you have a specific diet. It doesn't matter if you're vegan or vegetarian or you like meat and fish. It's that you're getting the proper nutrients, and you're getting enough calories too. So that's where I think utilizing other resources like a registered dietitian who works with athletes is really important.
8 to 10 hours of sleep, that's something that we can all subscribe to. Food as fuel is another thing we can all subscribe to. In your time dealing with young athletes, you've been doing this for a long time. What, in your view, has been the biggest kind of cultural change in how we deal with young athletes and how they prepare themselves?
I think one of the big overarching change that I've seen over the past 2 decades is that there's just more pressure on the athletes. As more and more athletes are specializing, are doing sports year round, are on travel teams, school teams, maybe multiple travel teams, there's just more pressure to try to get into college through sports, get a scholarship, become a professional athlete. So that's really increased quite a bit. And, with the now with NIL, both at the collegiate and just more recently in Virginia, the Virginia High School League has approved it for the high school. I think that has the possibility of increasing pressure. It might benefit some athletes, especially more at the collegiate level. I'm a little bit concerned about the younger athletes. It might benefit just a very small percentage, but put more pressure on a larger majority.
I do want to hit on one thing that you've mentioned, because you've mentioned it twice now, and it's the idea of specialization. We've talked about this at length many, many times, but when I was a high school athlete in the mid 90s, and we still were kind of in the seasonal calendar, but that started to shift towards the end of my time. Have you seen a change back to sort of seasons, or has specialization really begun to take hold, especially now that we're talking about NIL? I know there's a lot of data out there about why specialization is not necessarily beneficial to the youth athlete from an injury standpoint, pressure standpoint, mental health. But have you started to see a sea change swing back, the pendulum back towards seasonal, or are we still on that track to all-time specialization?
I think we're still seeing more people specializing. I think there are people who are getting the message and understanding the importance of multiple sports. I mean, we know from research that the people who are succeeding and making it to the collegiate level and the professional level, the majority of them, greater than 90% in some sports, have done multiple sports throughout their career. I mean, we did a recent study with the NBA and USA basketball, and it showed that the majority were multi-sports athlete. It just helps them physically and mentally. I am always glad to see when patients, athletes, and their parents come into the office and they're playing multiple sports, because I do think it's beneficial. So some people are getting the message. The problem is that parents and athletes also feel the pressure from organizations that they need to pick one sport, especially once they're in high school, in order to make the team and in order to succeed.
I think that's very important, especially hearing that the top level athletes, the best athletes in the world, are historically playing multiple sports at the youth level. And I think that's something that we need to continue to convey to the stakeholders all over, not just here in Virginia, but all over. Right. Speaking of stakeholders, what can youth athlete stakeholders do to improve how we approach mental health and wellness when it comes to youth sports?
I think of three things. One is to just keep it in the conversation. We need to keep this conversation going. I'm glad that we had started the Alliance and all these sessions over the past 3 years. I think that's important. We also need to keep in mind that the number one most important person is the athlete themselves. And that's what we need to focus on, how we can help the athlete succeed as a person. And then we need to just continue collaboration. I mean, the great thing about the Alliance is that, there's more than 40 different stakeholders there from all different parts of youth sports. And I think that collaboration is just going to make us stronger and hopefully more successful.
Yeah, you can't destigmatize the topic unless you talk about it. And I think we've done a very good job of talking about it. And now we're looking at those next steps as well. And speaking of those next steps, if we could look into the crystal ball 5 to 10 years from now, what would be a positive outcome in regards to how the sports community regards mental health and wellness?
So I think a positive outcome could be three things. One, that the discussion around mental health and wellness and around treatment for this would be normalized. So just as normal as talking about an ACL injury or an ankle sprain would be talking about these issues. Also having more resources available. Right now, there's a scarcity of resources, especially when athletes need help. And then just overall seeing decreased rates of anxiety and depression and suicide in young athletes. I think those would be really positive outcomes.
Definitely a lot of work left to do, but I'm very appreciative that we have a resource like yourself who helps participate in the Alliance and conversations such as this. I know you're very busy, but I do appreciate the time that we got with you today. So Dr. Joel Brenner from CHKD Sports Medicine, thank you so much for your time today.
Oh, thanks for having me, Will. It's my pleasure.
And as with all of these conversations, this is a part of our hashtag Sports Mental Health Monday, sports and mental health conversations. All of our content is posted weekly on Mondays on all social media, Facebook, Twitter, Instagram, LinkedIn, and YouTube. So please continue to follow the Alliance and the hashtag Sports Mental Health Monday posts throughout 2023, and we will see you next time.